All right, a short while ago we saw just how the national lockdown can affect how we spend money, and if unchecked can lead to real challenges to our finances, health as well as our emotional well-being. Well, speaking to counselling psychologist Nkateko Ndala-Magoro about how to deal with this during and after COVID-19. She joins us now via Skype. Thanks so much for joining us. Welcome to the program. I know that during this time, you've been speaking to a number of clients, and I just wonder, typically, when we are under stressful situations such as this, being confined in small spaces with people for prolonged periods of time, what kind of things are coming up that you're seeing consistently with the people that you're talking to?
Thank you for having me, and afternoon to the listeners as well. Under the circumstances of being locked down, many of the things that come out, actually, there is a survey that was released yesterday by SADC. It was an online survey that was conducted throughout since the lockdown started, and the results revealed that about 55% of the respondents are suffering with anxiety and panic. And this is not surprising, the fact that people are suffering from anxiety and panic. And then among other things that people are suffering with is depression. Some are already suicidal. It's about 12% of the population that has reported on that online survey that they are suicidal. Many, up to about 60%, they are also talking about family relations that are not going well. And lastly, it's substance abuse and finances, as you have heard also from Dr. Matenji earlier on.
All right, so I'm really concerned about the suicide. Is it partly to do with the fear of COVID-19, and also, I guess, if it has had a huge financial impact in your life, being unable to earn an income and you're being stuck at home and you just don't know what's going to happen next?
True. The suicide, when we look at why it has gone up during this time, it's also mainly because other people were already suffering from mental illnesses, such as your depression, your OCD being obsessive compulsive behavior, and any other mental health illness. So the lockdown has exacerbated, so it has exaggerated the feelings of being depressed, the feeling of anxiety, the feelings of panic, where people now do not even know how to confront this because during the normal times, they are able to go and consult with their psychiatrist or their psychologist, or to be medicated, or even drink it off. But right now, because people don't have access to such, or they are not aware that they can still access their psychologist and their psychiatrist, they're sitting there in their corner, isolated, drastically isolated, or with poor support system, such as we see how it has risen up, that there is family dysfunction. So then those people end up being suicidal, from having a mild mental health illness to now having a very severe mental illness. And maybe I want to add and say, it's not only people who are suffering with mental health illnesses that have become ill in this time mentally. It's also people who are healthy, that because of the circumstances have made them to it has made them to find themselves in a very dire situation.
All right, talk to us a little bit about the dynamics of being with the same people for prolonged periods of time. I mean, this is your family, you love them, but it certainly does put a strain, doesn't it, when you're stuck together for prolonged periods of time. We've seen surveys, China, for example, where the divorce rate apparently spiked during this period of time of lockdown. What is it about being enclosed and stuck that causes some of these tensions to come out?
And I mean, as you're saying, we need to look at the family dynamics. Already, if the family dynamics, or the people that you are living with, there is not healthy relationships, you're not relating to each other in a healthy manner, this is only going to worsen. Obviously, it's also an opportunity for those who are in healthy relationships to strengthen the bonds, to grow closer together, and so on, especially in a place where we find ourselves being very busy in our daily lives, and maybe the lockdown has offered that opportunity. But that is only in healthy relationships where, people get along and, they are looking forward to be spending that kind of time. But for people who are already on a brink or a verge of dysfunction, this has brought about a very, very negative state, because, if you have to breathe and eat and be on top of each other literally 24/7,
Yeah.
and you don't have that outlet of going to work or being on the streets or being in the bar. Other people don't even know their families to start with, and we need to be honest. They don't know their kids. Some dads don't know their kids, even though they are there. They are not absent fathers, but they are not present in the day-to-day functioning of the family. So now they're being driven crazy by maybe a nonsensical, or what they might think it's nonsensical, when a child is asking for food every day. We are homeschooling right now. We are working. So it's a lot of compounding circumstances that then impact on the relationship, especially if those relationships are not healthy to start with.
So what do we do? How do we cope? How do we manage all of this? We're not psychologists.
For starters, we are available.
Yeah.
We are essential we are essential workers, because we are healthcare workers. So we are in reach in terms of online, just like you and I are doing right now. For people who are severe, obviously we can see them face to face. So that's one way of coping. The second one I want to emphasize is support system, and maybe talking on or linking onto the previous point of saying, but you are in this place and you can't wait to be out of that community where it's supposed to be love and regard and so on. So where do you then find support? There's many online resources and also online platforms that allow us to connect as a community. Do a video chat, do a video call to people that they will be able to listen to you, they will be able to support you. I found that exercising is one of the highest forms in which people can cope right now. I am very much aware. I'm speaking from a place of a lot of awareness that other people are in confound spaces. They are sharing a very small space with a number of people that might not be that possible as people with more space. But anything to increase the heart rate, to just sweat it out a little bit, to just be able to be cathartic in a healthier way. So I think I support that very much. And doing things that maybe you might have put off for a longest time because you are busy, to get to those things that you think if you channel your energy in that way, you will be able to release that tension. Not going to the fridge a million times like many of us have done, but looking for something that is more constructive, that will add value as well in our lives at the end of this lockdown. Hopefully there will be an end.
No, it will pass for sure. And I guess we just need to find the best ways for us to get through this difficult time. But thanks so much indeed for your thoughts and advice. And let's hope that those who have been watching will start to think, how do we fix this? And try and use some of those resources that you mentioned. Thanks so much indeed for joining us. That's counselling psychologist Nkateko Ndala-Magoro. Thanks so much indeed for your time.
Thank you for having me, Peter.
All right, okay, so don't kill each other. Be kind, be nice, get help. And there's always a solution somewhere.